Good evening, everyone. Hope you enjoy our song service. You will turn your hymnals to 306. Draw me nearer. 306. 3, 4. I am thine, O Lord, I have heard thy voice, and it told thy love to me. But I long to rise in the arms of faith, and be closer drawn to thee. Draw me nearer, nearer, blessed Lord, to the cross where thou hast died. Draw me nearer, nearer, blessed Lord, to the precious bleeding side. Consecrate me now to thy service, Lord, by the power of grace divine. May my soul look up with a steadfast soul, and my will be lost in thine. Draw me nearer, nearer, blessed Lord, to thy cross where thou hast died. Draw me nearer, nearer, blessed Lord, to thy precious bleeding side. Oh, the pure delight of a single love, that before thy throne I spend. When I kneel in prayer, and with thee, my God, I will commune as friend with friend. Draw me nearer, nearer, blessed Lord, to thy cross where thou hast died. Draw me nearer, nearer, blessed Lord, to thy precious bleeding side. We will do some choruses now. We're going to start with It's Bubbling. 3, 4. It's bubbling, it's bubbling, it's bubbling in my soul. I'm singing, I'm shouting, for Jesus made me whole. Some folks aren't understanding, but I can't keep it quiet. It's to be you, baby, L-I-N-G, bubbling in my soul. I found a new life, I found a new life. If anybody asks you, what's the matter with you, my friend? Tell them not to say they keep it tight, but be something fine. Holy Ghost will walk the baptize. Jesus is mine, I found a new life. What can wash away my sins? Nothing but the blood of Jesus. What can make you pure again? Nothing but the blood of Jesus. Oh, precious is thy flow, that makes me white as snow. Oh, other am I know, nothing but the blood of Jesus. Amen. 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 Hope you enjoyed our song service.
AYAIM, the Advent message to all the world in my generation. AY motto, the love of Christ compels me. AY pledge, present arms. Loving the Lord Jesus, I promise to take an active part in the youth ministry of the church, doing what I can to help others and to finish the work of the gospel in all the world. Order arms.
G'day. Our scripture reading is taken from Psalms chapter 139, verses 13 to 16, and it reads, For thou hast possessed my reins, thou hast covered me in my mother's womb. I will praise thee, for I am fearfully and wonderfully made. Marvelous are thy works, and that my soul knoweth right well. my substance that was not hid from thee when I was made in secret. I curiously walked in the lowest parts of the earth. Thine eyes did see my substance, yet being unperfect, and in thy book all my members were written, which in continuance were fashioned, when as yet there was none of them.
Welcome, welcome one, welcome all to this Sabbath AY program, 7th of November 2020. This evening, we will be speaking on the topic of abortion. So, sit back, mute your mics, and begin to write. We will be taking all comments and questions after the presentation. Welcome.
Would I know you now if you walked into the room, if you stilled the crowd, if your light just fell the gloom, if I saw your wounds, touch your thorn-pierced brow, I wonder if I'd know you now. Would I know you now if you walked into this place? Would I cause you shame? Would my games be your disgrace? Would I worship you, falling on my face? I wonder if I'd know you now. Or have the images I painted so distorted who you are, that even if the world were looking, they could not see you, the real you? Have I changed the true reflections to fulfill my own desire, making you what I want, not showing you forth divine? Oh, divine. Would I miss you now if you left and closed the door? Would my flesh cry out, I don't need you anymore? Would I follow you? Could I be restored? Oh, I wonder if I'd ever learn. I wonder if I'd know you
Happy Sabbath and welcome once again to AY Today. All three churches from our district will be participating in this evening's program. The topic today is very controversial: abortion. In many countries around the world, abortion is a legitimate option for a woman when she's pregnant. She can choose to keep the baby, she can choose to give it up for adoption, or she can choose to have an abortion. What is an abortion? An abortion is the removal of pregnancy tissue, products of conception, or the fetus and placenta, also known as the afterbirth, from the uterus. This was given by Harvard Health Publishing. The fetus and placenta is used after 8 weeks of the pregnancy. Pregnancy tissue and products of conception refer to the tissues produced by the union of an egg and sperm before 8 weeks of the pregnancy. The Britannica Encyclopedia explains abortion as the expulsion of a fetus from the uterus before it has reached the stage of viability. In human beings, that is up to the 20th week of gestation. Abortion goes by numerous terms. We have elective abortion, which is the interruption of a pregnancy before the 20th week of gestation at the woman's request for reasons other than maternal health or fetal disease. Please note, most abortions in the US and even in TNT, even though it's illegal, happens for this reason. Induced abortion, an abortion that is brought about intentionally, which is the opposite of spontaneous abortion or a miscarriage, which is a loss of a pregnancy without outside intervention before 20 weeks of gestation. This is the termination of a pregnancy in order to save the life of the woman. In most cases, the woman may have mental health conditions. When it comes to abortion, who decides? We will explore a range of subtopics under this main topic of abortion. The two different types of abortion and how they are performed, long-term and short-term effects of abortion, the social, political, as well as religious view of abortion, the different countries in the world view of abortion. Some have abortion legal with restrictions, some no restrictions. Some countries it's completely illegal, and others it is illegal but allowed for certain reasons. We'll explore the biblical view of abortion as well as the S.D.A stance on abortion. Disclaimer: this content may be sort of graphic, so it may not be suitable for children. You may want to find an activity to occupy them in the meantime. Also, this program is not meant to chastise anyone or to point fingers. It is merely to educate and inform us all in a loving manner. If you feel that the content may be too much for you, you should stop viewing and resume at a later date. Today's program will be found at the Petit Valley Seventh-day Adventist website on YouTube, and you can view at a later date. Thanks all for tuning in to today's program. I hope you are left better educated to make an informed choice in the future. We will now have two videos on the different types of abortion, medical and surgical. Thank you.
There are two types of abortion available: surgical and medical. In this video, we will focus on medical abortion. Medical abortion, often referred to as the abortion pill, is a safe and effective way of ending a pregnancy. The pill is usually taken within the first 12 weeks of gestation. The whole process can take up to 2 weeks to complete, although most women feel normal again after just 2 days. Depending on the method, it can be up to 98% effective. How does it work? Medical abortion can consist of two types of medication: mifepristone and misoprostol. Using a combination of both is the most effective method. Mifepristone works by blocking progesterone, a hormone necessary to maintain a pregnancy, while misoprostol works by causing the uterus to contract and empty. The combination method requires 1 mifepristone pill followed by 4 misoprostol pills 24 to 48 hours later. If mifepristone is not available, misoprostol can be taken on its own. This method is slightly less effective. When taking misoprostol alone, 12 pills are to be taken within a 12-hour period. 4 every 3 hours is the recommended procedure to follow. What can you expect from a medical abortion? Misoprostol causes cramping and bleeding to empty the uterus. It can feel like a heavy period, and it's not uncommon to pass large blood clots during the process. Side effects can include diarrhea and vomiting, tiredness, mild fever or chills, headaches, and dizziness. To ease pain and discomfort, some of the following may help. Staying at home or in a comfortable space when taking the pills, taking ibuprofen or painkillers before the procedure, having a hot bath or shower, ensuring a friend or family member present to help reassure and comfort you, having an emergency plan in place for any potential complications. Urgent medical advice will need to be sought if you experience excess heavy bleeding, if more than 2 pads are filled per hour for 2 hours, intense pain, continuous vomiting, a fever of higher than 38 degrees Celsius that persists for longer than 12 hours. What happens next? This will depend on each woman's individual experience. Most women can expect tiredness, cramping, and bleeding for a few days. Within 24 to 48 hours, most women feel fine to return to their daily routine. Although it is not essential, it is advisable to plan a follow-up appointment with a health provider 2 weeks after the procedure. They can confirm if the process was successful and discuss your contraceptive options. What happens to periods? Periods should return to normal 4 to 6 weeks after taking the pills. If it does not return, a pregnancy test should be taken to confirm there are no longer signs of a pregnancy. In this video, we will focus on surgical abortion by vacuum aspiration, which is the recommended method of surgical abortion up to 14 weeks of pregnancy. What is vacuum aspiration? Vacuum aspiration is a minor surgical procedure where the uterus is emptied using a gentle suction. Vacuum aspiration offers women a safe, quick, and highly effective way to end a pregnancy. This method is effective between 95% to 99% of the time when performed by a trained health professional. Depending on availability, the procedure will be performed with either a manual vacuum or an electrical vacuum. What to expect from a surgical abortion? A vacuum aspiration involves a cannula, a thin tube being inserted through the vagina and cervix into the uterus, where a gentle vacuum is created to empty the contents of the uterus. Some minor pain and discomfort can be expected during the procedure, and pain management should be provided. For some people, taking ibuprofen will be sufficient, while others will choose to have a local anesthetic or mild sedation, though this is not always required. The whole process should take between 5 to 10 minutes to complete. It is advisable to rest for 30 to 40 minutes after the procedure has taken place. If you have been given a local or general anesthetic, it is advisable that you have someone accompany you home and to remain with you until the anesthetic has worn off. What happens next? Vacuum aspiration is a minor procedure, and most people will feel fine to return to their daily routine the next day. It is normal to experience some irregular bleeding or spotting for a few weeks following the procedure. During the first week, avoid inserting tampons or menstrual cups and use only pads. Cramps similar to menstrual cramps can be expected, which may last several hours and possibly for a few days following the procedure. To ease the discomfort, you can take painkillers such as ibuprofen or use heating pads. What happens to your period? Your period should return within 4 to 6 weeks of your abortion. If 8 weeks pass and you still haven't had a period, contact your local healthcare provider to make sure your abortion is complete.
Hey Psych2Goers, welcome back to another video. We would like to give you a big thank you for all the support you've given us. Psych2Go's mission is to make psychology and mental health more accessible to everyone. Now back to the video. Have you ever wondered about the best way to maintain a good relationship? What keeps a relationship active and healthy? While it's important to have good chemistry with someone, it's also important to put in work and effort into your relationship. It can get difficult at times, so it's important you and your partner have good habits in your relationship for it to grow and flourish. Before we begin, we'd like to mention that while this video covers some features of healthy relationships, it's normal that not everyone fulfills all these points. It is also possible that there may be some methods out there that this video did not mention. With that said, Psych2Go shares with you 8 healthy habits of a relationship. Number 1. You show your affection. Are you able to be vulnerable with your partner? Closeness and trust often go hand in hand. Hand-holding, hugging, cuddling, and kissing are all engagements of physical contact that may help reassure each other of your love for each other. It's a silent and implicit way to let your partner know you're there for them and that you love them. Number 2. You're able to communicate with each other. Are you comfortable communicating with your partner? Holding judgment and keeping an open mind is important for you to engage in an honest conversation with them. Instead of letting your unresolved feelings fester up inside, it's important to cultivate a safe space where both of you are unafraid to speak up about problems in your relationship. Number 3. You emotionally bond with them. Are you able to laugh together or talk about your feelings with each other? Any strong relationship needs a solid foundation of emotional bonding. Whether it's by laughing and being silly together or having deep discussions about life, being able to be emotionally intimate with your partner is really important and a good sign of a healthy relationship. Number 4. You make up after arguments. Are you stubborn at times and refuse to make up after a fight? Or do you own up to your mistakes and go the extra mile to make things okay? It's important to learn how to make amends with your partner after an argument. Fighting is what produces distance and often leads to breakups, so a strong relationship involves not holding grudges and a willingness to admit when you're wrong. Number 5. You appreciate each other. Do you tell your partner how special they are and how much they mean to you? Having mutual respect and appreciation is one of the keys to maintaining a healthy relationship. It can be easy to take someone for granted and forget to show them how much you care. So, it's important to be thankful and appreciate all the things you do for each other to maintain a healthy relationship. Number 6. You see a future together. Do you actually see a future with your partner? Knowing that you'll always be together through thick and thin and maintaining that kind of faith is a big deal. Life throws curveballs often when you least expect them, so being able to count on your partner to be there by your side every step of the way is important for a strong relationship. Number 7. You balance housework. Do you do all the chores in the house? Whether it's about doing chores or running errands, balance is key in a relationship. Maybe you're more experienced in cooking than your partner, so maybe they could wash the dishes or vacuum the floor instead. If housework or tasks that should be done by the both of you are always being completed by only you or your partner, feelings of resentment may arise and cause problems in your relationship. Number 8. You give each other personal space. Do you have time and space for yourself that is away from your partner? While closeness and intimacy are important in a relationship, it's also crucial to have boundaries. Despite having a close connection, you and your partner also need personal space as well. Too much time together may lead to feelings of frustration or resentment. Therefore, a healthy relationship requires a balance between the time you spend yourself and with your partner. Are you in a relationship? What habits do you form to make it last? Psych2Go would love to hear your thoughts, so please leave a comment down below. If you enjoyed this video,
Hi, welcome back again. Please note the content that's shown in the 2 videos on surgical and medical abortions are not to promote abortion or to endorse it. It's merely to explain why or the reasons why the 2 types of abortion are carried out in countries where they are legal. We will have a short panel discussion by 4 guests. My guests will indicate who they are and as well as their career. But before we go into that, I just want to give some statistics on abortion in the world. According to the UN, which is, they have gathered information up to 2019, abortion is allowed in 98% of countries in the world in order to save a woman's life. Commonly accepted reasons for preserving physical, 72%, or mental health, 69%. In cases of rape or incest, 61%, as well as cases of fetal impairment, 61%. Performing an abortion because of economic or social reasons is accepted in 37% of countries in the world. Performing abortion only on the basis of a woman's request is allowed in 34% of the countries in the world, including the United States, Canada, most European countries, and China. So as we can clearly see, in the developed countries, abortion has been legalized. We will now go into our panel discussion. We have our four panelists, Dr. Edward Clark, Dr. Oscar Ocho, Dr. Loris Sosa Anani, and Mrs. Maria Lyons Edwards. Welcome everyone, and good afternoon.
Good afternoon.
Good afternoon.
So my first question, the video said that abortion, whether it be medical or surgical, are fairly safe. Is that true?
Could you repeat the question again? I didn't hear. The ending was a bit fuzzy.
The two videos indicated that surgical and medical abortions are safe. Is that true?
Well, okay, let someone else answer first.
Sorry. Within the context of healthcare environment, because the environment in which the procedure is carried out is generally safe, which is the question you asked.
Yeah. Okay. Are all abortions, whether they be medical or surgical, successful? Do all end in successfully terminating the pregnancy?
Sorry.
Sorry.
Yeah, I just wanted to add at what Dr. Ocho was saying about if abortion is safe. Actually, I wanted just to point out that if we compare abortion and pregnancy and delivery, okay? Because like in the modern world and even in developing countries, maternal death is still the highest cause of death among women. So abortion is a procedure that is much more safe than delivery. So in that sense, we can say that abortion is safe. But the other problem that we can get in the developing world and in countries where abortion is not legal, many people use, unofficial way of aborting. And even health professionals, they don't do it in hospital or in health facilities. So that's, in those places, abortion is not really safe. That's why I wanted to point out before we move forward.
No problem. Okay, so back to our second question. Are all medical and surgical abortions successfully done? Are there any survivors of abortion? Is it common to have survivors of abortion?
I think that my colleagues answered the question in a way, because it depends on the environment. As was noted with the last speaker, if the abortion occurs in what we call backstreet environments where the hygienic procedures and the sterile procedures aren't there, then of course you're going to get all kinds of complications and difficulties. And and sometimes the women have to go back to get certain go to hospitals then to get other procedures done to to make them safe. So it depends on the environment in which the abortion takes place. You know, and here I presume that you're talking about voluntary abortions and not involuntary ones.
And if I were to just add to what Dr. Clark and my colleague would have said, while it is safe because it's done in what we call a therapeutic or medical environment, with everything that is human, there could be challenges. So if in case we have what we call retained products of conception, where the entire placenta is not expelled, of course, there is risk of infection, and there is also going to be risk of postpartum hemorrhage. And both of them could have serious implications for the life of the woman. We also have to bear in mind that there are times when abortions are done in the third trimester, and third trimester abortions could have, not will have, more challenges, because you're talking about the approach to the abortion is different to the second trimester abortions. And it would have been nice if you had seen the two videos, because they helped to show the difference between both types of abortion.
How does abortion affect one mentally? You may go ahead, sorry, you may go ahead.
Yes, what I was saying is that we are not already the ethical and moral grounds, but from a legal perspective, it is one of the more potent arguments that persons would have used in terms of the legalization of abortion, in that when abortion is not legal, it discriminates against those who are less fortunate and cannot afford to go to a proper medical institution. So what will happen, let's take the example, what we would call a backdoor abortion in Trinidad and Tobago. That is what happened. So that is why throughout the world, they use it as a very powerful argument in terms of legalizing abortion and putting it in a legislative framework so that can be done. All right, so that is just from strict legal perspective.
Okay. Any of my colleagues, Larissa, I'll have you go and then I'll speak.
Yeah. Actually, I just wanted to come back to the question as if all medical or surgical abortion successful. Okay, actually, back home, we have some, I'm from Cameroon. We have some, if I can say, I don't know how you say that, abortion survivors, but that is the medical one, because it's really difficult for surgical abortion not to be successful. Because if you understand the process, it's really a process that made to, I don't want to hurt people, but to kill the baby. So it's really difficult for the surgical abortion not to be successful. But it happened that with medical abortion, the health professional thought that the product of conception is expulsed, is out, but is not. And after a while, the woman, because they will tell her that normally your period will come after 4 to 6 weeks, and she will think that, okay, it's just because the period is not yet there. After 8 weeks, she will try to go back, and then she will realize that they will tell her, actually, the baby is still there. And sometimes some of them, they will say, okay, maybe God just wants me to keep the baby. Meanwhile, they use a procedure that if they did it, or medication that they use usually, and it works with most of the people, but it did not work with that person. So it happened with medical abortion, but not with surgical abortion.
Understood.
I just
And
wanted
how,
to say, based on what Maria would have said, in Trinidad and Tobago, abortion is not legalized. However, there is a policy position of the Ministry of Health where an individual could have access to what we call a therapeutic abortion if in case the health of the mother is at risk or the viability of the fetus is also at risk, which is totally different to someone deciding to terminate a pregnancy by going to a backstreet environment. That's why the policy position is distinct from that.
understood. And we will discuss that a little later in one of our other questions. So you'll go into more detail. And my next question is, can abortion affect you mentally?
Well, that's a very interesting question, because when one looks at research over the last 30 years, the data shows that there is no tremendous adverse psychological effect from abortion, believe it or not. And if you scan all the data, you will see that that's the case. There have been many, there have been investigations during Reagan's time. He sent out a task team to look at it, and all the evidence points to the fact that there's no greater psychological impact on the mother. But there is practical evidence to show that there is psychological impact. And I think about 2 weeks ago, I have a student in my class, and she had an involuntary abortion. And she was devastated. And she called me because she had decided to take her life. She had already swallowed a quantity of tablets and was screaming and sobbing and saying that she was going to take her life. So obviously she was experiencing suicidal intentions. She obviously was depressed. And so there are psychological consequences. I hasten to say that this is the confounding part of research, because if you check, you will see that all the research doesn't give a conclusive findings that the impact of abortion is very detrimental to the mental health. But we know that it does have an effect. So it's a very interesting thing. I think, and for me, the catalyst is whether the woman wanted the pregnant or didn't want the pregnancy or didn't want the pregnancy. To me, it seems to be that is a very important factor in deciding, the effect that is likely to have, because she wanted to have this baby and she was devastated. But the research shows that if it's an unwanted pregnancy, the mother is convinced that she need to get rid of this, the psychological impact on her is not as great as someone who wanted that pregnancy. So that's my comment.
My follow-up question to that will be whether the study took into account that the woman that they would have surveyed, if she thought abortion to be okay. Because if as a woman, I think it's okay and I'm not doing anything wrong, I'm making the best decision or best choice for myself or my baby or fetus, then I probably may not be affected psychologically as someone who sees it as something bad that they're doing and they cannot stop with it and it's not the best choice. So they may be impacted, whether it be guilt or even shame or even feelings of they took their baby's life. Because I would have seen numerous videos on YouTube as well, and even heard some testimonies where women were very distraught that they had done an abortion. So
Yeah.
that's just my follow-up point.
Yeah, but that's the point I'm making. There is there's no clear categorical statement about if you have an abortion, you're going to be depressed and suicidal and feeling guilt and shame and all that. It is not a black and white situation. It depends very much on how the woman perceived that procedure. If it's something that she wants, there's something that she's calculating the consequences of that. And I suppose you could make a comparison in a very different way to mothers who have babies and then decide to put them in a dustbin or to put them outside of somebody's home or a nursing home or something like that. They're just saying, I don't want you, rejecting the child. So and they don't, and some of them feel it is within the child's best interest to be with someone who I can look after you, as well as other persons who have feelings of guilt and shame and low self-esteem and all that sort of thing. So the research findings are not conclusive. That's the most I could say about that. I suppose an aside would be it depends on one's religious persuasion and one's own philosophy of life and how life should be managed. Yeah.
And before we continue, I'd just like to make two, and you're free to comment. Well, most people will be most familiar with the case of Roe and Wade from the United States of America. This is the defining case on abortion in the United States. And it came out of a young lady. She was 22 years old, and she wanted to have an abortion in Texas. At that point of time, it was illegal. As a result of that, there was a push, and they had the case. It was overturned, and they agreed that abortion can be done on therapeutic basis only. However, Roe versus Wade, the person that the lady, right? She has reversed her position on abortion, which is quite interesting. And she has indicated that it was years after that she realized that it was wrong. And she realized that what she has done was wrong, and that she said, she came to the point, and just right there, she said, I felt crushed under the truth of the realization. She was working in an abortion clinic, and she said she finally was able to face up to the reality that abortion wasn't about the products of conception. It wasn't about missed periods. It wasn't about children being killed in their mother's wombs. All these years, I was wrong. Sitting, I realized I was wrong. I was working in an abortion clinic, and I realized that it was wrong. So this is the person who had the most significant role in Roe versus Wade in the United States of America. But it was years after she came to that realization. Our next anecdotal point is that I did a trial in 2020, so most likely it's 2019. And it concerned a young lady. She had 2 voluntary abortions in Trinidad and Tobago. What happened, and we're talking about the mental impact in it, 2 voluntary abortions. At the end of the second abortion, a very good friend became pregnant. At the end, what she did is that, well, we don't want to say she was responsible in some way for the mother's death. And when they eventually did the investigation, she was at home with the baby, telling everybody, this is my baby. And she was eventually arrested and charged for murder. But it was very clear that as she had her last abortion, the young girl who was a friend, in about 3 weeks later was dead, and she had her baby at home. Telling she went to her mother, she went by her grandmother, and she said, "This is my baby." She went to her boyfriend and said, "This is our baby," and the crazy boyfriend agreed that this is my baby. So that it's just to get a comment on how did, even though she voluntarily aborted her child, how does she reach to the point where she now decides to be responsible for her friend's death and has the baby claiming it is her own?
Okay, I just wanted to add at what they are saying, that from my experience, because working in tertiary education with many young students and being very close to young people, I realized that the psychological trouble, as Dr. Edward was saying, depends on many factors. Okay, the age when the abortion is performed, the support system from the family or friends, the society view on abortion. Is it legal? Is it illegal? The complications that can come after, because I sometimes I had some students who will do that. Of course, they don't want to have they had sex without protection, but they don't want to have a baby. They are studying. And like when you study, especially in Adventist campuses, if you are not married, you cannot have a child. I mean, back home is like that. So they will just suspend you. You will not, maybe you will come after a year or after 2 years, depending on the suspension. So some of them, they do. But if sometimes they think it's okay, especially if they are not really Christians, if they are not Adventist, they think it's okay. But when after 1 week, 2 weeks, they start to struggle to see that, I mean, maybe they still carry some pain. They feel that they are no longer the same. Something is different with them. Then they will come to you, and you can see that psychologically, they cannot speak to their parents. They will come to you and they will cry. They need help. They need prayers. You can see that they are really struggling to find themselves again. But after a while, working with them, they will find themselves. So I do think that there are some psychological struggles. But to end to depression or to suicide, I think some do go up to that. But I mean, the scientific world does not really agree. There is not, study does not really conclude, it's not a consensus that this is it. But from my experience, I think it depends on many factors, and it does happen. It do happen.
And just to add, I think one of the things we have to bear in mind is that societal values are changing. Yeah. So whereas in the past, having worked in HIV for a number of years since the late 80s, there were lots of debates on, let's talk about the morning after pill, where people are going there, having sexual intercourse, and they're saying, look, I don't want to get pregnant. So they go and they take this morning after pill, which could be taken between 24 and 72 hours. And so that is going to prevent, as it were, the implant fertilization of the egg by the sperm. So people their consciences and their values have changed to the extent that it's not about, I have sinned against God. It's about, I do not want the evidence of my action to become known. That's one. The other critical thing is the debate among the the practitioners as well as the psychologists and sociologists and the ethicists. When does life begin? Because you have people who are still of the view that if the fetus is not viable, and we talk about viability, where the fetus, it's possible for that fetus, if it is birthed, to be able to survive, of course, with ventilatory and other support. There's this debate that if that fetus is not viable, then you can consider it an abortion. So therefore, the ethical dilemma that we have to contend with is also influencing people's values, people's beliefs, how people see this. But we also have to bear in mind that the General Conference has a clearly articulated position, which was revised in 2019. First, it was in 1992. It was revised in 2019, and it is more deliberate and comprehensive, where the churches...
Dr. Ocho, I would like you to hold on to that point, as that question will come up later.
Right.
So I don't want to go too much into it right now.
Yes.
Is that okay?
Very much.
Yes. So I'd like to move on to our next question. And it says here, well, you mentioned previously that in TNT, abortion is prohibited. And you listed one reason it can't be performed. Can you just repeat that?
Yes. It's not that it is prohibited. And Maria, as the legal luminary on the team, will tell you prohibition is different to not being legal. Yeah. So that it is not legalized, but under certain conditions, it is allowed. That's the policy position of the ministry. So if a woman's life is at risk, that's one condition under which she can have a therapeutic abortion, and that will be done within the hospital or some clinical setting. On the other hand, if there are issues with the viability of the fetus, that's also a condition. Let's say there is some level of deformity or some other challenge. The debate, though, is about whether somebody who was raped getting the abortion. So while it may be allowed, again, sometimes depending on the practitioner's value, it may impact on the readily available support system for the conduct of that therapeutic abortion.
So you mentioned that if the fetus may have some sort of impairment, does the law or the policy specify the type of impairment, as in Down syndrome or any other disability? Or
no,
is it
I don't know if it goes on that specific, but I think Maria may be in a better position.
Okay. I saw Dr. Clark. Dr. Clark, you wanted to say something for a while?
No, you go ahead. I'll follow.
All right. Okay. Trinidad and Tobago's abortion law, it is still restrictive in that there are no exceptions to the abortion law. So what happens, there's a difference between what is legal and what Dr. Ocho is indicating is that actually the law is not enforced. So there's a policy position. Now, sometimes law comes down to policy, but on the books, it is illegal. And I will contrast it. So our offenses against the Person Act, there are two sections, sections 54 and sections 55 of the Offenses Against the Person Act. Those two sections, there is no exception. So that is why we will have what is called a very restrictive approach to abortion law on the books. So that's what you hear the term a law is on the books. A law is because it's not enforced. I looked up, we have had no challenges to the abortion law. I won't be surprised if one turns up at some point in time. If it does, based on the common law throughout the rest of the jurisdictions of the world, most likely it will be overturned. But in Trinidad, if you seek to procure an abortion, right? What the law says in section 56 is that any woman who is with child with intent to procure her own miscarriage unlawfully. So in other words, they have not defined what the lawful means of administering, but I think it will be interpreted through the common law as to the therapeutic conditions that the Ocho spoke, right? In the common law, which is where the policy position comes in. And if there's a push for the amendment of the law, this is what will happen. And I look at Diana's example for a while. So any poison or any noxious thing, right? If she seeks to that and unlawfully uses any instrument by any means whatsoever with like intent, she is liable to imprisonment for 4 years. So that's the maximum term. It is 4 years. So that is for a person who seeks to induce an abortion, right? So that is her punishment. It is 4 years. Now there's a next. Pardon?
And what about a practitioner?
Right, I'm coming to that, right? So that is section 56 of the Offenses Against the Person Act. When we go into section 57, it deals with any person who unlawfully supplies or procures any poison or any other noxious thing or any instrument whatsoever, knowing that the same is intended to be unlawfully used or employed with intent to procure the miscarriage of that woman. Now, this is the interesting part of both laws. Whether or not she is with child, that person is liable to imprisonment for 2 years. So if you seek to procure it for yourself, you are liable to 4 years. If the doctor, anybody who seeks to assist, anyone who seeks to assist, sometimes it's the husband, the boyfriend, the doctor, whatever, 2 years. No. The law says that it is irrelevant whether or not the person was actually pregnant. So law is broken. Yes, it sounds strange, so I've explained it to you, right? Welcome to law. What it is actually saying is that impossibility is not an excuse. So sometimes people commit offenses, but it was impossible for them to commit the offense. So the intent is sufficient to make out the offense. You intended to procure an abortion. She thought she was pregnant. She did everything that was necessary to procure an abortion. And then she finds out, oops, I'm not pregnant. The law says it is irrelevant, right? What happened? You had in law, there are two terms that make out an offense. It's called the mens rea, which is your intent, and the actus reus, which is actually the act, right? So the woman or the doctor would have done both. They had the intent to commit the offense, and actually they did all that was necessary to commit the offense. It was impossible because the woman wasn't pregnant, but the impossibility does not matter. So I just want to contrast that with what has happened in Guyana. Guyana is a country has an act called the Medical Termination of Pregnancy Act. This was passed in 1995. What Dr. Ocho was speaking about is what they have. Now, they allow abortions for certain reasons, and I'm going to read it. If it will involve a risk to the life of the pregnant woman or grave injury to her physical and mental health. So that is one basis. This is the therapeutic reasons. This was dealt with in Roe and Wade. Then there's a next one. There's substantial risk that if the child were born, it would suffer such physical or mental abnormalities as to be seriously handicapped. That's the next basis for it. On account of the person being of unsound mind and the woman is not capable of taking care of the infant, where the woman reasonably believes that her pregnancy was caused by an act of rape or incest and submits. So she has to say that. They will ask her for a statement, probably sent by the JP or whoever, where the woman is known to be HIV positive and where there's clear evidence that the pregnancy resulted in, now this is the most liberal part of their what they call the Medical Termination of Pregnancy Act. It says where there's clear evidence that the pregnancy resulted in spite of the use of good faith of a recognized contraceptive method by the pregnant woman or partner. So if you're using one contraception and it didn't work, you could get an abortion, right? So that is a stark contrast. So our own is restrictive in that there are no exceptions being allowed. And in Guyana, they have given five exceptions. So that is the difference, all right, in what we have. And other countries have it also, but their one that is an example of the difference.
So based on what you just said about Guyana,
Yes.
and they allowing abortion for certain conditions, do you think our country should allow abortions for rape, incest, and a threat to women's life? Because I know there's an agency, an NGO, Aspire, that is advocating for like safe parenthood in TNT. And I was trying to get some information on it, but it basically was saying that, you know, we want to sort of look at abortion reform in TNT, whereby people can have the choice to have an abortion if they have been raped or there was incest, or if the person, there's a threat to the woman's life.
Yes. Oh, you want my view on it? I think, firstly, I don't think it should be your first recourse to do that. I really don't think it should be your first recourse. I think what needs to be put in place is various options for the lady. I think or the woman or the couple. I think also, so that shouldn't be the first course. I also think that we need to look at it, not a carte blanche approach, because as Christians, we have to accept that the Bible does not say abortion is the way to go, right? But if we look at the SDA statement, we would see their position. However, I believe there are circumstances where it would be necessary. But I don't think we can have a carte blanche approach. I think we should go on a case by case basis, and people with the necessary expertise who are involved in that person's life would be the ones to make the decision. But it should not be the first course of action, or it should not be asked per course. That is my view on it.
What about any of the panelists?
I totally agree with Maria's position, and I feel very strongly because abortion should not be a woman's issue, but a family issue. And I say that because too often the debate and discussion about abortion surrounds a woman's right. Well, if it was her right, then she should have gotten pregnant by herself. She should have impregnated herself. But since pregnancy doesn't happen that way, we have to recognize that too often we, as a society, because of our value systems have changed, we take things too lightly, and we believe that we could make decisions to the extent that we are satisfied and we are comfortable, and it doesn't matter what happens down the road. Because that same person who may be single and has an abortion and feels good and comfortable, that same person who ends up in a marriage relationship, and because they would have gone through a backstreet abortion and now realizes that she's infertile, what impact is that going to have on her when she now wants a family? So I think we need to recognize that God has provided sex as an avenue for procreation. And anybody who ends up in a sexual act should know that one of the fruits of your labor is pregnancy.
Understood.
Okay. Okay, I just wanted to talk a little bit about the law in Cameroon, okay? Because I think it's almost the same like in Trinidad, and because abortion is not legal, I mean, and it is possible to do that only in case of rape of incest or disease. Yes, or when the life of the mother is threatened. So those are the 4 conditions under which abortion can be um, done. But the issue is that, I mean, there is also a kind of hypocrisy from the society, because abortion is a felony. But you will see in drugstores, they will sell abortion kits. And when you walk close to universities or close, to the main university, you will see that those drugstores, those pharmacies, they will set like maybe 100 kits per weeks. You understand? So I think also as Dr. Ocho was saying, our societies are changing, because before you could not see a drugstore selling like abortion kits. People will just do it back door, as you were saying a while ago. People will do it, we just do it behind. But you cannot understand how come the state does not legalize it, but still we let health professionals, because I was saying in the beginning, most of the people who do it are nurses and doctors. And most of the time in health facilities, it's not done officially, but it is done. It is widespread. Because before it was not like open. People will not know, where am I going to abort? How am I going to do that? But these days, still it's not legalized, but people do it openly. And you can do it by yourself by getting a kit, or you can, when you are, I mean, it's when it's very, very early in the first trimester that you can use a kit. But when it's already advanced, you need to go to the health facilities, or you need to go to, because we have only traditional doctors. You need to go to the traditional doctors, you understand? So what is done, but as the law is concerned, and we are not, I mean, Cameroon is not a Christian country. If we say Christian are maybe only 1/3 of the country, you understand? We are not a Christian country, but abortion is not legalized. But still, people do that, and openly, and everyone knows it.
I think it's necessary for me to say something about it. I live in South Africa, and of course,
Dr. Clark, can you speak a bit louder,
yeah,
please?
I'm saying I live in South Africa, and the government legalized abortion in 1996, and as a matter of fact, there are certain clinics they call Maria Stoops clinics. You can go and book yourself into those clinics and you can have an abortion. As a matter of fact, you're driving along the road, you're in a suburb, it's an ordinary house, just like any house, and you wouldn't even know that that's where people go to have their pregnancy terminated. I think one needs to understand from the South African perspective, we had many persons losing their lives, having serious physical damages, hemorrhaging, all those sort of things, from visiting the illegal offerings, places where abortions were performed, and even in some doctors' rooms, because not all doctors follow the same procedure or know what to do. And so the government decided to regularize and standardize the whole procedure and practice. So abortion is legal in South Africa. You can go to these clinics, and that's all they do. That's all they do. They don't do anything else. I suppose they do have some counseling or preparatory counseling before the abortion is performed, where they ask you, to find out why you want to do it, and et cetera, et cetera. And just to give you a chance to decide that if you don't want it, you can just walk out of the clinic. And and it's performed by professionals in those clinics. It's not a clinic, as I said, it's not a clinic like you would go to one of the clinics in Trinidad. It's not like that. It's actually a house, but it offers, when you get in, the facility provides those services. And it's a one day facility. You go in, you don't stay overnight, you get sorted out and you leave. Interestingly, they are situated near health facilities. So, I presume one of the reasons being that if there are any complications, they can easily take you over to one of the health facilities that's nearby. But we overcome that problem. Now, views about abortion are steeped in controversy because of a person's religious persuasions. Catholics believe that from conception, the fetus or the embryo is life. And that's their view. And they hold on to that view. As in one of the countries that was very much like that is Ireland, for instance, which is a very big Catholic country. And they're beginning to become more acceptable on certain types of abortions. So one's position about abortion is really wedded to one's philosophical and religious belief system. If you are a libertine, if you're a women's liberation activist, you'll have one view. If you're a traditional, devout Christian, a Muslim, you will have a different view. And therefore, and it is quite interesting, but I don't want to comment on it until we get to that question. And it's very interesting about the Adventist view on abortion, but we don't talk about that just yet. So, and I think that we need to, this is my position anyway, I think we need to respect other people's views. They don't have to necessarily match ours, but very often there's a basis for that. So, I mean, okay, people who are very liberal find the Catholic view to be hostile, right? and not given any room, like we have discussed in Guyana and some of the other countries, right? You're killing a life. You didn't generate life, so you have no right terminating life. That's it, black and white. There are other situations that we just heard where the mother's life is at risk. Other positions where the fetus is compromised to the extent where this bring it to term, this child would have a very, very difficult life. So therefore, in the interest of everybody, it's best to terminate it. So you have these varied views about it. And it comes down really to one's own personalized, as I said, philosophical view and religious view of life and the hereafter.
So at this time, we're going to close off our first session where we're going to special music, and then we will come back with the panelists with the remainder of questions, and we will be answering questions from the YouTube chat. Thank you.
Good afternoon. Please be reminded that God is in control of everything, no matter what you're going through. I've walked among the shadows, you wiped my tears away, and I felt the pain of heartbreak, and I've seen the brighter days, And I've prayed prayers to heaven from my lowest place. And I have held the blessing God you give and take away. No matter what I have, your grace is enough. And no matter where I am, I'm standing in your love. On the mountains I will bow my life to the one who set me there. In the valley I will lift my eyes to the one who sees me there. When I'm standing on the mountain, I didn't get there on my own. When I'm walking the valley, I know I am not alone. You're God of the hills and valleys, the hills and valleys, God of the hills and valleys, and I am not alone. I've watched my dreams get broken. In you I hope again. No matter what, I know I'm safe inside your hand. On the mountains I will bow my life to the one who set me there. In the valley I will lift my eyes to the one who sees me there. When I'm standing on the mountain, I didn't get there on my own. When I'm walking through the valley, I know I am not alone. You're God of the hills and valleys, the hills and valleys, God of the hills and valleys, and I am not alone. Father, you give and take away every joy and every pain. Through it all, you will remain. Over it all, Father, you give and take away every joy and every pain. Through it all, you will remain. Over it all, on the mountains I will bow my life. Yeah. In the valley I will lift my eyes. Oh, on the mountains I will bow my life to the one who sent me there. In the valley I will lift my eyes to the one who sees me there. When I'm standing on the mountain, I didn't get there on my own. When I'm walking through the valley, I know I am not alone. No, I'm not alone. I know I am not alone. You're God of the hills and valleys, the hills and valleys, God of the hills. And I am not alone, God of the hills. He is God of the valley. He's God of the hills and valleys, and we are not alone.
Hi everyone, good evening. My name is Renisha Waldron and I'm representing the Petit Valley and Patna Seventh-day Adventist Church, and today it is my pleasure to present on the short and long-term effects of having an abortion. So the focus is mainly on the negative effects. These effects include how does abortion affect the physical body, what are some of the emotional or psychological effects, and lastly, how does it affect the family and community at large. So after having an abortion, a woman can experience abdominal pain and discomfort. Now, this pain and discomfort that she is experiencing may not be helped by medication or by a heating pad. So the pain can be really, really severe. She can also have vaginal bleeding. Now, this bleeding can be continuous and heavy. So, for example, the bleeding can be so heavy that it soaks up 2 or more parts in 1 hour. And doing so, with the bleeding, there can be passing of blood clots. Vaginal discharge is also an effect. It may be discolored and smelly, and one can have a fever or infection, and this can be proven by an elevated temperature. Also, a woman can experience being nauseous and having breasts that are sore. So there are other serious complications of abortion, and these include damage to the cervix. One can have preterm births for future references. And when I say preterm births, I am referring to a baby that may be small for his or her gestational age, and as a result carry a low birth weight. Some women, after having an abortion, may not be able to get pregnant in the future. And some examples of this include ectopic pregnancy. So that occurs when the fertilized egg grows outside of a woman's uterus. So in layman terms, that means it is somewhere else except in the uterus, right? She can experience a spontaneous abortion, that is, pregnancy loss at approximately less than 20 weeks, not utilizing any medical or surgical measures to terminate the pregnancy. She can have a stillbirth, and that is delivery of a baby who no longer has life. So basically, the woman will have to deliver or push out a baby that is dead. She can have scarring of the uterine lining, and also we can have the ultimate, which is that occurring. So there's a slogan: when someone is pregnant, there's 1 foot in, 1 foot out, right? So in abortion, the same applies. So we are moving on to the emotional or psychological impact of abortion. So after having abortion, evidence has shown that a woman can decline in her emotional health. So she can be feeling guilty, depressed, having flashbacks of the abortion, and even suicidal thoughts. So there are a lot of negative effects when it comes to the topic abortion. Also, because of these emotional health issues experienced after abortion, it can have an effect in the family. So because of this woman now having to deal with all these things, she can by extension portray these negative psychological behaviors towards children that she may have before even her husband, and these could lead to further problems like divorce and etc. And lastly, how does it affect the community? Well, there's a slogan that says it takes a village to raise a child, and also that when you get pregnant, it's basically from the womb to the tomb. But if abortion occurs, then within the community, if members are aware, that means that they could miss out on the opportunity of being able to raise a child that may have great potential for the future. So I thank you for your attention, and I hope that you will continue to enjoy the rest of this program.
So we will now answer one of the questions from our YouTube channel, and it says, what is the S.D.A Church's stance on therapeutic abortion? Anyone of our panelists? What is the S.D.A Church's stance on therapeutic abortion?
In looking at the church's position that was voted on in 2019, the church has not differentiated between therapeutic and other types of abortion. While the church indicates it's sensitive to the social and medical and other issues, the church's position was informed by its theological posture, which says that it is not God's intent. However, the statement ended by encouraging the need for sensitivity to individuals who may choose to do that. So while the church is saying, no, this is not acceptable from a theological position, this does not give us the right to judge the person, but we need to be supportive of such individuals.
And we have another question here, and it says, what about the child? Who really has rights over pregnancy? For example, in the case of surrogacy, is it the woman, the partner, or the children's rights are prioritized?
Okay, I will deal with this one. Unborn child does not have any legal rights. So that is the basic position of law, not in terms of any legislative framework, but in terms of the what we would call the common law, or what has been decided by cases dealing with abortion. So all cases dealing with abortion, and if I can give an example, it talks about, let me see, all right, there was this case in Canada, and it was a case of the state of Canada against Drummond, all right, and here what this lady did. This woman was acquitted of murder after shooting a pellet gun into her canal 2 days before her full-term child was due to be born. The child, you look shocked, right? And she was acquitted, and the reason was that a child is not legally a person and therefore does not have any rights. So you cannot kill or you cannot murder an unborn child in law. There was also another case again in Canada, and this dealt with a lady. The woman had a drug problem. She was addicted to glue sniffing, and her children were born and they were disabled as a result of her addiction. The Child and Family Services sought to take the mother away for healthcare and for treatment, and the purpose was to ensure the protection of the child. They overturned the plans of the Child and Family Care Services, and this is what they said in the Court of Appeal up there. They said that child protection laws cannot be extended to unborn children. The Supreme Court of Canada agreed with this ruling, saying that G's child is not a legal person and does not have any rights. So who has rights? The mother has rights. And it is as Dr. Ocho said, when we look at most of the legislation, they come down on, if we go to the Constitution, section 4 of our Constitution talks about the right to life, liberty, and security of person. It also talks, we don't have a right to privacy, but in other countries they have the right to privacy. How is this interpreted in the common law? It is interpreted by saying that a woman, it is the woman, not the partner, or should I say, not the husband. Partner has many connotations. It is
Yes,
not
yes.
the husband, right, that has the rights. The woman has the right to determine what to do with her body. And this includes the unborn, and that is why it's called the unborn child or the fetus, right? So she has a right to determine what to do with the child. And it says that it is a breach of a constitutional right if it is you are telling a woman who doesn't want to keep a child to keep that child. They said it will affect her mental health. It will affect simple things like her plans and her desires for her life. It will affect that. So that if one constitutional right is affected, then she has a right to determine how to treat for that child and what to do with the unborn child, which is not a person and has no rights.
Okay. So we
Okay.
have another
Can I?
question here. What is our
Uh,
SDA's biblical abortion stance in the case of a woman being raped? Is it the best advice to have the baby and place the child up for adoption?
I think Larissa was about to ask a question or respond to.
yeah, actually, I just wanted to add to the first question that Maria uh, replied to. I think that's why Christians has problem with laws, because as for the Bible, I mean, based on the Bible, we see that from conception there is already life, but the law will determine life. We know life will just start maybe when the fetus is viable, okay, when the fetus can live. Or so they will determine, okay, from 20 weeks, that is life, okay. But for Christians, because when we read throughout the Bible, we realize that life starts. Nathan, sorry, sorry. Okay, good boy. Yeah, sorry. Yeah, from the Bible, life starts since conception, and we can even say that it starts from the mind of God, because there are some verses that tells us that even before we were born, God knew us. So it means that is the same person that was in God's mind, is the same person that is conceived, is the same person who is at 1 week, that is 3 months after birth, that is an old man of 79 years old. Because if the person does not pass through all those stages, the person will never reach 79 or 80 years old. So that's why Christians have issues with the law. I think it's a thing to try to, I mean, because the job of the state is also to try to dance between many people who has different beliefs.
Yeah.
But the thing is that is a baby that is conceived, is a fetus, a human being. Yes, is a human being, because all human beings are fetus first before being a born, before being born. So I think if people in the state, law people, try to answer that question that way and to make Christian understand that, yeah, we accept this. But the thing is that we need to make all people agree and try to see situation one by one, and to see if we can allow things to happen, abortion to happen in certain cases. I think if it's explained like that, there will be less tension between Christians and lawgivers.
Just to respond, and this is the problem. Now, the question was phrased in terms of what rights, right? And the law is not Unfortunately, but the law is not about morality.
Yeah.
The law does not seek to settle when life begins. The law does not interest itself in, and this is what it actually said. What is what is conception and when does life begin? They say, you know what? Go to church for that. When life begins, that is not our business. We have a view, and that is when the child is viable. When does conception begin? Not our business. So they don't seek to settle those issues. The law is simply saying, listen to me. We live in a democratic society. And in a democratic society, we have to consider all views. And we have to see how we could enforce all views. And law is very, very important to reflect the values of society. So that when you see a lot of legislative changes coming, they say that the law must reflect the society in which we live. That is why I said that if the abortion law, Section 56 and Section 57 of the Offenses of the Person Act is challenged in Trinidad, most likely they will go down to what's happening in Guyana, or even a more liberal perspective. So law and morality are two completely different things. And it is important that as Adventists, I am a lawyer, right? But I'm an Adventist. Our position has to come, we have to reflect the statement of the Seventh-day Adventist Church and unborn life. So everybody should read that. And when it read it, it starts with Psalms 139, right? When life begins. Before you were born, the Lord considered you. So we have to know the Adventist position, the Christian position. But when you come to legal rights, it is not reflected in our society. Now, if we look at what's happening in the United States, there's a backlash against the Roe and Wade decision. So a lot of these states are making abortion legal. And that is why one of the reasons why Trump, who is no longer the president, right, right, why Trump was supported by the evangelical movement because of his position on abortion. So in spite of all the wrong things Trump do, well, we have him here. So we have to understand the complicated and the divisive nature of abortion. But I urge everyone, go and read and study it yourself and get a biblical view of abortion.
So we have a question from a medical physician, an upcoming Christian S.D.A medical physician. And he or she says, is it then expected or advised that I make decisions regarding abortion based on my conscience? And you touched on it just now. Can anyone give a perspective on this?
As a healthcare provider, you have the option of referrals. So if I am a practitioner and I am uncomfortable based on a position that clearly goes against my philosophical posture, I have the right of saying to the person, I am not comfortable and I am willing to refer you. Will you be willing to accept that referral? The challenge comes when you might be the only person to make certain decisions. And I have had to contend with that at a period when I was director of population program unit, because there were some Catholic nurses who did not want to participate in the family planning clinics because they said it was against their religious view, but there were other nurses who were there. So the other nurses took charge of the family planning clinics. Yeah, but you have that privilege, yes.
Anyone else before we move on to the final question?
Yeah, as a healthcare provider, when I started to work in a maternal and child clinic, I mean, like for young people or people who are not married, when someone will come for contraception, for pills or whatever, you want a device, and you talk to the person, you realize the person is sexually active. Okay, you are a Christian. Like if I give the pills to this person, do I encourage a person to do fornication? That is a good question, right?
Yeah.
Yeah, yeah. So, but I'm also a healthcare provider. So that is a personal choice, I think, that we need as healthcare provider, we need to make the decision. So when you find yourself in a place where what your work requires you to do goes against what you believe, you need to take a decision. That's why sometimes as health provider and as Christian, we sometimes face that reality. You need to make a choice and you need to stand to use the Bible to make your choice. And that's why I will tell to that medical doctor, like what I was doing, what I believed is that my role is also to help people to understand that they need to make the right choice for themselves. So I will, like for the pills, I will give all my knowledge, my biblical knowledge about why the person should not engage in sexual relationships before marriage. But at the same time, I see it as my duty. Since the person made her choice already, it was my duty to tell her that, okay, those are the things that you can use to make sure that she will not go behind and use things that are not good for her. So that was my choice. So I think as health provider, we usually need to make choices. And as Dr. Ocho said, the law, most of the law in most of the states, we have that in the law. I mean, maybe Mara will help. Like we cannot do things. The law allows us not to do things that are against our conscience. Most of the states allow that. So we are not forced, even if we are physicians, we are not forced to do things that are against our conscience. That's what Dr. Ocho was talking about, referral. But we should not, the other mistake that health professionals do sometimes is that they want to force their belief on patients. And that is wrong because we are not all Christians. And even if we are not Christians, we don't understand the Bible the same way.
Yeah.
So we cannot force our beliefs. What I believe is different from what Dr. Ocho believes. Even though we are Seventh-day Adventists, there are some texts that are not so clear, so we can understand them differently. So it's really important for us to avoid that. But the main issue is that we need to know that that is a personal decision. And as brother and sister, we need to avoid to judge people based on their action, because someone can do something because he realized, for him, he thought deeply about what decision I should take. And for him, he think it's the right decision. But sometimes us, we will look at him and we say, oh no, he's wrong, he's not right. And we need to avoid that. For those sensitive issues, it's not easy for anyone, but let people take their personal decisions.
Okay, I just want to make a few observations. Professional counseling is a very interesting intersection between what is right, what is wrong, what should be done. And I've listened, and people come to us for advice. And guess what? We don't give advice. Professional counselors don't give advice. So I am not going to tell you what text and verse in the Bible to read. I am not going to tell you whether you should have an abortion or not. That's not my role as a professional counselor. It might be as a pastor, but I am not a pastor. I'm a professional counselor. So therefore, whether I am Adventist or I'm not an Adventist, but I am an Adventist, I don't counsel people from using the Bible as my reference. Because to me, that's, first of all, it's biased. Secondly, it's against the counseling codes, right? So that's not what counselors are supposed to do. Now, you might feel that you want to do that because you are so convicted by your religious belief that you should be doing it. But by doing that, you are likely to cause more harm than good. So we don't do that. And we don't teach it in our schools, may I say. We don't teach it to the people we train. And I want to make that very clear. So what we do as professional counselors is to give the client the options. We tell them what the options are. And, and they must come to a conclusion. They must arrive at a decision themselves. We are not supposed to be biased and influenced. Well, you can never be unbiased, but we are not supposed to influence their decisions in that respect, because it has serious implications for the future. So that if a counselor were to say to someone, well, God says this, and therefore you shouldn't do that, and they follow your own suggestions because you're supposed to be the knowledgeable person, you're the professional, and then they go and do what you say they should do, and then the consequences are such that it causes tremendous complications and difficulties in their lives. They'll come back to you and say, well, brother Dr. Clark, you said so. I went and I did so. Look what happened. So professionally, it's unacceptable. The American Professional Psychological Association advises us not to do those things. So you can, as a matter of fact, you can lose your license if you engage in behavior which is construed as non-professional. So in matters like that, abortion, etc., we take the view that with Socratic questioning, we expose you to the options that you have and the consequences for each action. So if you did this, here are the consequences. If you did Y, here are the consequences. And we let the person think about the consequences of their actions. And then they must arrive at the decision at the end of it. Now, for some persons, that might seem like not wanting to take responsibility, but that's not my role as a counselor, to take responsibility for somebody's decision. That's not it. And then lastly, if a person comes to you and you find that the nature of the case that's being presented is one which challenges you with some deep-seated sense of consciousness, you can say, I'm sorry, with respect, you need to go and see counselor X or A or B. What my brother was talking about, refer. You need to refer. But you're not supposed to take on a case and then try to make that, because of your own biased views and beliefs and whatever, try then to get the person to follow or ascribe to some views that you might hold very dearly. So that's my position on that. That's the professional position that I hold, and that's what we teach in the schools.
So before we close, we have one more question from our chat, and it says here, Do men experience psychological effects of abortion they have not agreed to?
That they're what, sorry?
Do men experience psychological effects of abortion they have not agreed to?
Oh, okay. Well, I'm going to start because I'm a man. It's interesting. Again, it depends on the context, because if you're in a marital arrangement, if you are in a non-marital arrangement, it can play out differently. Let me give you. I like to look at. Let me give you a case study. I have a friend, very wealthy gentleman, but he wasn't always like that. And his wife decided to have a cesarean. And she did not tell him that she was going to have a cesarean. And he already had 2 children, a son and a daughter. And he wanted, and they were in their teens, going to high school. And he wanted to have another child. And so he kept trying and trying and trying. And then he wanted to know what was happening. So he decided we should go to the doctor to find out what's going on. And the doctor gave him a surprise of his life by telling him, hey, listen, your wife was had a cesarean, so she can't conceive. And he was devastated. And he divorced his wife.
Oh, she did the procedure to prevent herself from becoming pregnant.
Yes.
Oh, you said a cesarean, so I'm like,
Yes. Yeah. Sorry, I was thinking about something. Yes. She. I'm sorry. And therefore, it wasn't cesarean. She had her womb taken out. Right. Good. So so she could have no children. Yeah. And so he discovered that, and he was shocked, and he divorced her. All right. So let's get back to and just saying that to get back to the question. So if
can I come in here?
Yeah.
Did that doctor breach confidentiality?
Well, yes and no, because when they went for the examination, right? The doctor said to him in front of her, are you aware that your wife doesn't have a uterus? Right? Are you aware? And he wasn't aware. He was not aware.
So that's different, yeah.
Yeah, he wasn't aware. And therefore, I mean, his reaction was quite bad to that. So getting back to the question then is that if you are married and your wife went and aborted a child and didn't consult with you, that is a serious case. As a matter of fact, I am not so sure if the law still, but I know in England, your wife could not tie her tubes unless she got her husband's consent. In England, and I know this from personal experience, when we had 3 children and my wife said she doesn't want anymore, and she was lying on the bed and she wanted to tie her tubes, the doctor says, well, I can't do that. I need to get your husband to sign off this. So I'm therefore assuming that if your spouse had an abortion and didn't tell you about it, that it would have serious consequences for the relationship. Now,
anyone else?
And the psychological consequences, outcomes of that are really quite telling.
Dr. Clark, just to indicate that position where a woman had to get consent for certain things, they have moved to the position that a woman has a right to decide. And this position where she had to get the man's consent and all of that, the woman is the one who's really affected by it. So it really seems to have come down to what the woman wants to do. She gets to do.
So that's the recent.
Yeah, recent, which has both the pros and cons to it, but it just seems to be the woman's right. She's the mother. Let her decide.
Yeah. Okay. So my answer would be yes, it has implications for the relationship.
Anyone just want to say closing remarks before we close off? We come to the end of AY.
I just want to say that abortion is still not God's ideal. As children of God, we are still to encourage our people, both young and old, that God has an expectation of all of us. However, for those who would have made decisions that even were inconsistent with God's design, God is still a God of second chances, and His grace is sufficient.
Amen.
Okay, if I can add to that, I think, as Dr. Ocho was saying, God is a God of life. He's a giver of life and the sustainer of life. So God cannot be for abortion. So the Bible cannot be for abortion. So as Christians, we need to understand that. It's true that the law can give us rooms in certain cases to do abortion. But if it's just because women's rights give us the opportunity to change our minds, as Christians, I think we need to be careful with the actions that we take in that direction. God is a God of life. And as far as I know, as I was saying a while ago, a human being is alive from the mind of his creator up to the day of his death. So we need to be careful, young people, to take care of ourselves, to take care of our body, not expose ourselves, avoid to put yourself in position where you can start to think about abortion. Avoid to put yourselves, I will say it again, because I saw in the video they were talking about cuddling, kissing. Sometimes relationships start with those little things, and then it ends with protected sex, and then non-protected sex, and then it ends with pregnancy. So avoid to put yourselves in position where you will start to think about abortion.
I'd just like to say that outside the whole remit of abortions, we have to make God informed choices in life. So all our decisions that we make has to be informed by what would God have me to do. When I get myself in a sticky situation, how would God have me to treat with it? And even if you have not done it God's way, God is a God of second chances. So that's the first position. The second thing is that let us have somebody in the church, let us have a friend who we could go to for support and counseling and advice when we find ourselves in difficult situations. Because whatever age we have reached, we have done wrong. We have done something wrong in life. In those moments of wrong, we need to understand who God is so that we could get through topics like these and abortion. There is a way out. There is support. There's encouragement. There is advice. We also have to think, when I do X, what are the consequences of it? So if we think short term, We have to go beyond the immediate result. So, my God, I'm pregnant. I can't deal with it. Let me have an abortion. Well, and what happens after that for the rest of your life? You need to work it out and then come back to the decision you need to make. But I pray to God that you will have somebody to talk to, somebody to encourage, and I encourage you to go to God first and ask Him, Lord, show me how to deal with this situation. And He will guide you into the way that you go. But there's no hard and fast. That's the principle we're working with. But people have different circumstances in our life. Let us seek to encourage each other, point them to the Word of God, pray, give necessary advice. If they have to go to a professional like Dr. Clark, well, that's what they would need. But friendship and relationship is important, and God is important for every situation we have in life. And that's the only recommendation that I could give. So I talked about the law, right? But we're in a Christian perspective now. God is not in favor of abortion carte blanche, and it's not a matter of convenience. That's my carte blanche position. After that, be wise.
All excellent points by all of our panelists.
Can I just make a concluding remark?
Yes.
I have tremendous empathy for young people who struggle with the big issue of emotions and desires, and how those emotions and desires can challenge them in a very serious way. And unfortunately, we don't spend the right amount of time in skilling our young people how to deal with these emotions, these huge upsurge in emotions as they're developing. They don't know. And their parents, sometimes the parents aren't equipped to handle it. And it's quite interesting that mothers don't pay much attention to their sons. They pay more attention to their daughters. And none of this can happen without the sons. So we need to have a holistic approach. Whether we have sons or daughters, we need to let them know what is the proper way. And I think if we can begin from understanding the purity of the body, and as the Bible says, it's a temple of God, and you can get your sons and daughters to understand the responsibility that they have, then we may begin to we can make an impact when now they come to you with, should I have an abortion or shouldn't I? We need to start at first base and nurture our children in such a way that they would understand these things and understand the sanctity and the purity that's necessary to bring in their lives, so that, and especially if they have a religious persuasion and they're Adventists, so that they can understand how they should live. These were things that were common teaching opportunities in our AY programs many years ago. I noticed that we tend not to deal with these things either because it's a sensitive topic or because we would be offending others. But I think it's high time that we get back to first principles. And I think that would do a lot of good in nurturing our children to know what is the right way to live and what is the responsibilities they have as human beings in their relationship with God and what He expects of them. Thank you.
So I would like to thank each and every one of our panelists. Dr. Edward Clark, psychologist, Dr. Oscar Ocho, nursing administrator, Dr. Laurie Sosa Anani, nursing educator, and Mrs. Maria Lyons Edwards, attorney at law. Thank you so much for being a part of our panel discussion this evening on the topic abortion. And we will now have our closing and prayer. Everyone is created in the image of God, and we are all unborn women and men worthy of life. God loves us all and He cares for each of us individually. As our scripture reading said, Psalms 139, 13 to 14, for you created my inmost being. You knit me together in my mother's womb. I praise you because I am fearfully and wonderfully made. Your words are wonderful. I know that fully well. God recognizes us and gives value to our life. Galatians 1:15 says, but when God, who set me apart from my mother's womb and called me by his grace, was pleased, here I was, vain. This is where Paul was talking about him being chosen by God from since in his mother's womb. Within the third week of pregnancy, the baby has its first nerve cells formed according to Cleveland Clinic website. It also says at the moment of fertilization, the baby's genetic makeup is complete, including its sex. 4 weeks, the baby has a tiny heart tube that beats 65 times per minute. Between weeks 5 to 8, facial features develop, arms and legs, heart and kidneys. Both scientifically and biblically, we see that the fetus or embryo or unborn are people. Loving unborn babies and valuing their life is in no respect devaluing the woman's life. Both are loved by God, and Jesus gave his life to save both. I don't think we can merely say we are pro-choice or pro-life. It's like a political statement. But we are proponents of all life. The downtrodden, vulnerable, displaced, rich, poor, educated, everyone. As Christians, we should seek ways to help those in society that may not be in a position to help themselves. If you or a loved one have been affected by an abortion, I urge that you seek counseling and support immediately. There is life after an abortion, and God still loves you. I wish to thank everyone who tuned in to today's program. Thanks to all who contributed to preparing this program and making it a success. The Petit Valley members, Patna members, and Diego Martin Church members. Special thanks to Sister Rhonda from Diego Martin, Sister Shelley from Petit Valley, and Brother and Sister Dale and Sharon Alexander. Special thanks to all our panelists. We really appreciate you taking the time to participate in this evening's program on abortion. Can you bow your heads and pray with me? Heavenly Father, we come before you after this Sabbath day, dear God, giving thanks for this program, for all those who participated, for all those who would have listened, for all those who would have seen this video. I hope it has touched each and every one of us in a special way. We are not hosting this program to condemn anyone or criticize anyone or make a decision for anyone regarding abortion. It's everyone's choice, but I pray that before we look to this option as a viable means to terminate a pregnancy or deal with a solution, that we seek you and we seek your word. May this program have an impact on someone's life positively and bring about change, as well as help them to make an informed decision. I pray that we continue to look to you for guidance as we enter into the rest of the year and into the new year, and you continue to bless us as a church family. I thank you for all your love and your guidance. In Jesus' name I pray. Amen. Thank you, everyone. Thank